guys upon resettlement, health science, I need to be clear, health science students, health science students.
Come to you with the big boys who find you out of the waka. Let's alright to begin waka. Just like that, don't finish that.
Health science students of Government Secondary School Upper Resettlement and Health Bridge Initiative, a non-governmental organization, have taken to the streets to sensitize Abuja residents about health education. The students, displaying different placards on cancer, HIV and AIDS, polio and other diseases, had a sensitization walk from APO to the National Agency for the Control of AIDS, NACA. During the sensitization, they spoke about effects of the diseases, how they are contracted, and the best methods to avoid them. Mrs. Tamunosikyo Natoimbo, the health science teacher, explained the need for children to serve as agents of change in their communities.
My style of teaching is practical. In trying to convey theory, I try to make it real to the students. 2 weeks ago, I taught them blood typing. We took blood samples of a few students and they were able to learn how to read blood types and they were excited. And then just recently, I taught them the philosophy of health education. Why should you study health education? What is the purpose of education? And part of it is to promote good health. And then I thought to myself, why can't these children be active in creating sensitization in the community? Not just being passive as it has always been in the past, where they will come to them and tell them, hey, be careful with your health. Let them be active this time, going to the streets to tell people. And you know, you could have a concept and an idea, but if you don't have support from anyone, it makes it very difficult. The students are creating awareness on health information, specifically on cervical cancer. They're advising teenagers, or rather adolescents from the age of 9 to 14, to take the vaccine, the HPV vaccine, to protect them from cervical cancer. We're also telling people that lifestyle, that's what the students are doing, that lifestyle can also affect them. So creating awareness on HIV as well, which is something that's been overflogged in the past, but these are issues that we still need to address, and that is why we're here.
The Executive Director, Health Bridge Initiative, Dr. Sylvia Okoro, said that the students volunteered to join the campaign against HIV and AIDS, cervical, prostate and bowel cancers, as well as polio eradication. Okoro said that the NGO is actually transforming lives and leading the change when it comes to healthcare delivery, and that to create value, the value system must start from the secondary schools and the young ones.
So what they are trying to do is to create awareness, let the public know why this is necessary, why they should get testing, free HIV testing, the numbers they have to call, especially among young people, adolescents and young people like them. And secondly, they also want women to get screened. You know, the human papilloma virus vaccine is free. When they get it, the adolescents, when they are vaccinated, they get themselves free from cervical cancer. And not only that, it can also protect them against some genital infection like warts. What they are trying to tell their mates is that irrespective of where you find yourself, whether it's a government school or not, that they are supposed to create the value that is needed in adults. And for me personally, I believe that a lot of diseases, I mean over 80% of diseases that adults suffer today can actually be prevented. And when we start young and create the value in them, so coming from such background where you have people from all walks of life, people from poor background, but they say they want to create a change. We believe if we start from these young ones, we can really get it right in the Nigerian health sector. And I can tell you, coming from the HIV background, that what we are seeing today is the new infection that we are seeing today. We are actually getting them amongst the over 45 million people amongst them.
Dr. James Anini, the Director, Community Prevention, Care and Services, NACA, while receiving the students, said that the focus of the organization was on the young ones.
For those of you that are aware of family life and health education, are you aware of that?
Yes.
Okay, so it's implemented in your school?
Yes.
Okay, good. So we are also in the process of trying to review that guidelines to make it easier for people to pick up on what they are teaching you, and also to update it to reflect current trends. So That's one area we are looking at currently. December 1st, we celebrate World AIDS Day. And that's a day that we create a lot of awareness. We do a lot of testing. We go to specific locations. Better create awareness, and then also, if we can help it, maybe have a testing location in the school.
Some of the students bared their minds about the exercise.
I shared so many things to them. I told them about health science, how to prevent themselves, and also how to maintain personal health. I talked to them about HIV, how to prevent HIV, so on and so forth.
I was about to drop the subject, but my teacher, she made me understand that health science is the best. You learn things in health science. Because me, it's not that I don't know anything in health science, I know everything. But she made me proud to be myself, to be bold and strong.